Welcome back. The last remaining hospital operating in northern Gaza has been raided by Israeli forces, with patients and staff now evacuated. The director of Kamal Adwan Hospital said about 50 people have been killed, including 5 medical staff, in an Israeli airstrike on a nearby building. I'm joined now by Dr. James Smith, an emergency physician who worked in Gaza for over 2 months earlier this year and worked at the hospital, I think I'm right in saying.
That's right, Matt. I visited the hospital to retrieve critically unwell patients and to bring them to the south. So I met the director of the hospital. I walked through the wards there. I was present in the hospital grounds on one particular afternoon. I also visited several other hospitals in the north of Gaza and in Gaza City as well.
And now with this latest news, I imagine you'll have concerns for the people you worked alongside there.
I mean, this is horrific. The director of the hospital, Dr. Sophia, has been calling out now for 81 days. 81 days the hospital has been besieged by Israeli forces. Quadcopters, sniper fire into the maternity ward. Today, what we're hearing is that several critical departments have been hit and set alight, including the emergency room, the operating theatres. We know that there were about 150 healthcare workers in the hospital and approximately 100 patients. Some of those critically unwell patients were forcibly removed from the hospital and told to evacuate to other hospitals in the region. At the moment that I'm speaking to you, we don't know where those patients are. They haven't arrived at the Indonesian hospital. We don't believe they've arrived at any of the hospitals in Gaza City either.
Prior to this, James, medical provision for civilians in Gaza was already pretty terrible. What does this now mean for them?
I mean, we've seen 14 plus months of the systematic destruction of the Gazan healthcare system, which under the protracted occupation was actually a pretty robust healthcare system despite all of the constraints imposed upon it by the Israeli occupation. But 14 plus months of this, there is no functioning healthcare system. Our Palestinian colleagues, Palestinian healthcare workers are trying their absolute best under the most horrific conditions to provide care to severely unwell patients. We're talking about people with polytrauma as a result of Israeli airstrikes, all the way through to newborn premature babies. And they simply cannot provide the care that is required under the conditions that have been imposed upon them.
And in terms of other aid coming into the Strip, what are you hearing along those lines? Because, of course, we hear in the mainstream press about the limited resources still going into Gaza.
I mean, limited, I think, would be an overstatement. There is next to no humanitarian assistance entering into Gaza. So prior to October the 7th, 2023, we hear this statistic of 500 trucks a day. That was simply to sustain life. That was, of course, before the heightened needs that have been generated by the ongoing genocide. What's needed now is far more than has entered into Gaza for over 14 months. People are being quite literally systematically starved and dehydrated to death.
James, I have to ask, when it comes to hospitals and other buildings along those lines, the Israeli government would point to Hamas using them to hide behind. When you were there, when you were working in these places, did you see any of that?
No, Matt, and I think we need to systematically do away with these assertions. This is a military tactic that the Israeli forces have used to justify their attacks on pretty much every single healthcare facility in Gaza. They used it, of course, with Shifa. They've used it with almost every other essential healthcare facility in Gaza. There is no justification under international law for what is happening to Kamal Adwan and the healthcare workers, patients and civilians that are currently sheltering there.
Do you think you might go back at some point to continue to help out?
I think if our Palestinian colleagues ask us to return, then we return under their terms, and we do absolutely whatever we can to act and to be present as a form of medical solidarity, either during the genocide or in the wake of the genocide, absolutely.
Dr. James Smith, appreciate your time on Sky News this afternoon. Thank you.